Dr. Cyrus Mancherje. I'm an interventional cardiologist, been in the community for 25 plus years, and have been with NorthBay exclusively for the last couple of years. Well, a typical day for me in work includes a little bit of everything, and scattered through that I'm in the hospital as well, seeing patients in the hospital, plus doing procedures in the hospital. Unfortunately, cardiac procedures are usually never scheduled. They're all sort of emergency, urgent, semi-emergency, or very urgent. And as patients know, when they come and see me, sometimes it happens that I have to be called out of the office. And luckily, most of my patients have had some procedure done to them, so they're pretty understanding when I get called out to do something emergent for someone else as well. Well, I was a medical student at the University of Cape Town, which is in South Africa, and while being a medical student, I met a number of mentors in cardiology that really sort of influenced me. There were a lot of these old-time British-type cardiologists who could diagnose anything with a stethoscope, which is a lost art nowadays. So that was the first inspiration. The second inspiration was actually the guy who did the first heart transplant. Christian Barnard was one of my professors, and he was quite an influence on me. I got to see him operate, got to take care of his patients post-op, and that was one of the other influences. Okay. NorthBay is I think the ideal mix of a small family-type operation where everybody knows everybody, plus an organization that practices pretty much state-of-the-art quality medicine, and it brings it straight to the local public here. So I like the environment, I like the people I work with, plus I like the support we get from the hospital administration here. My advice to a patient looking for a cardiologist is to find someone that they can work with and communicate with. The most important thing is to have a cardiologist who's willing to sit down with you, communicate with you, help you understand your condition and what procedures and tests you have to go through, and to make you comfortable doing it, because some of these things are scary. The heart conditions are scary, and certainly the tests we have to go through create a lot of anxiety. So it's important not just to communicate, but to reassure the patients as well. This is something I've tried to do for my patients over the years, and I think they appreciate it.